I support the discussion moving forward, and that's what the president is looking for, and we're hopeful that it won't add to the deficit, that we can look forward to a bill that's actually going to provide some major reforms. And as like any bill, even when one passes, there's always time to go back and look at what reforms and changes need to be added, because things do change. They don't stay stagnant, especially in Washington. The cost of getting health care is so expensive, or employers that they work for don't provide them with coverage because they can't afford to get into an insurance plan, a pooling plan that will actually lower costs to allow them to provide that coverage. I just think that it's always been a problem for our community in the last few years, and because it keeps growing and growing our population, we're finding that we need to do something to create cost controls. If people just use, for example, the emergency trauma units for their health care, that is entirely too expensive. But if we can get people enrolled early on in prevention programs, to be able to go to community clinics, to do more prevention, and see a doctor regularly instead of waiting until the last moment when they're really, really sick or acutely sick, that will save costs and allow for the federal government to kind of spread those costs over time. Best thing to do right now is concentrate on where the careers are going to be growing. The careers are going to be growing in renewable energy, which New Mexico is really great. They have an expanded portfolio of all kinds of energy technology programs that are available. They can get into training programs that the government will help pay for if they qualify. So now's the time to take advantage of that when the economy has contracted. So they have to be ready, though, but they have to be ready to take that challenge.